My answer for most patients is yes. In my practice, if you've recovered well and everything is pretty routine, I'm very comfortable with starting the next step, whether it's another egg retrieval or moving on to an embryo transfer, immediately with the period or withdrawal bleed after that last treatment cycle. After an egg retrieval, you can expect a withdrawal bleed or a period, usually within 1 to 2 weeks. And after the test post embryo transfer and stopping medications, whether you're doing a medicated or cryo-natural approach, we're expecting a withdrawal bleed usually within 5 to 7 days of stopping med. When it comes to getting your period and going immediately into another retrieval cycles, studies have been reassuring in showing no drop in egg yield, fertilization rates, as well as the rate of obtaining euploid embryos in the immediate next cycle. And when it comes to transfers, there have been several studies that have failed to show a difference in live birth rates, the rate of pregnancy loss, when comparing going straight from one transfer attempt into the next cycle attempt versus taking a break in between transfer cycles. Similarly, if you've experienced an early first trimester miscarriage, once you've had a bleed and your HCG levels have gotten down to a negative level or their baseline, then it is completely fine to move forward with next steps, pending completing any necessary tests, especially if you've had more than one miscarriage. It may make sense to take a pause and do a recurrent pregnancy loss workup at that time. Whether someone should proceed right away or if they need to take a little bit of a pause depends on so many factors, like their age, how time sensitive their situation is, their personal schedule and timeline. Sometimes someone knows that they have a difficult schedule ahead, whether it be work or travel related, and they feel like it's just best to get started even without having full results from their current cycle. They just want to keep it rolling and move on to the next. I will rarely recommend taking a pause if someone had significant hyperstimulation syndrome or if they had any sort of medical issues or complications and they need time to recover, or if they need mental space and bandwidth to recover and steel themselves for the next attempt emotionally. Another reason to pause or delay could be logistical because you're waiting for insurance to determine the level of coverage for a subsequent cycle. Taking a short break or pause could mean going on birth control to freeze your cycle at baseline so that you have flexibility to pivot to either doing another retrieval or doing another transfer, depending on what the results of that current cycle are. A pause could also mean just taking the cycle off and not doing anything and just waiting till the next period. Generally speaking, totally fine with that if a patient needs to take a break, but it's not something that I will say this is necessary. Sometimes having full results from that cycle can be helpful to understand how to best troubleshoot the next cycle, what dose and protocol to use in the case of an egg retrieval. But in reality, most of these decisions are going to be based on how many eggs were retrieved relative to the baseline count, how many of those eggs were actually mature. And you're going to know this and even how many eggs fertilize normally by the day after the egg retrieval, well before you would get your next period to start another cycle in 1 to 2 weeks. The bottom line for me is if your labs, your ultrasound, and your recovery are all going smoothly and look good, then I think it's fine to keep up the momentum and to do a retrieval or an embryo transfer right away in the subsequent cycle. This is a strategy that I use every day in my practice to help patients save time without sacrificing the outcome.